Direct composite restorations, class 3 and 4, contact points, internal effects, new clinical case, special for you. Let's go. Hello dear colleagues, hello dear friends, we are back with BG Dental cases, and this time I'm going to present you a very interesting clinical case where we made direct composite restorations for centrals and lateral incisors, class 3 and 4. We will be discussing how to do contact points, how to work with tints to create so-called internal effects. So I hope that the information that I'm going to share with you will be useful and you will get some clinical tips and tricks that will help to increase or enhance your daily practice. Let's go. This is our initial clinical situation. The patient has previous composite restorations made a few years ago, and she was not happy with their appearance. She was not happy with discoloration of that restorations. She would like to change these restorations for the new ones, and also she asked from our side to keep her color, so she didn't want to make this whiter or darker, and that was a way that we decided to go for direct restoration rather than ceramic veneers. Okay, and we had also some caries defect that we had to treat on during this case. Before I will continue explaining step by step our approach, I would like to ask you one question. If you will take a precise look at this picture, you'll be able to see a difference, actually, the difference between levels of enamel and composite on all of these teeth. Especially it is very visible on the tooth number 21 and tooth number 22. You can see enamel that is higher than level of composite. So we have some step between two structures. And it is very important to understand why it happened. Okay, you have to understand why it happened before you do new restorations, because patient actually was not happy with that. I would like to ask you this question, and I would like you to write down in comments under that video your answers, okay? I will read them later on and I will reply, and definitely I'm going to tell you a real cause of that situation at the end of this presentation. So I will go back to this slide at the end and I will explain how did I find the reason why it happened and what we actually did to avoid that. Okay, so let us continue. We go for that slide, and this is actually the protocol for direct restorations. We do frontal pictures, lateral views, and also we take some pictures from incisal edge. The picture from incisal edge is pretty important. I mean, this one. This picture actually shows you the difference in level between enamel and composite, right? That picture also is good to be taken, or let's say not picture, but that view has to be used during layering process, because during layering process you'll be able to determine if you placed enough composite, or you have to add, or you have to remove, or whatever. So that will help you to see so-called dimensions. Another picture, that one is very used to show to yourself and also to your patient some caries defects that your patient may not see before coming to your office. So here you can see some caries defects. So we also said that we had to treat that things. We started our preparation before rubberdam placement. That will be easier than to apply our rubberdam and membrane, because interproximal contacts will be opened and rubberdam will be easily inserted between these teeth. Then afterwards we made rubberdam isolation. Here you can see the picture from the left side of the screen, this one. This is regular isolation with inversion. But then I decided to do so-called floss ligatures, floss ties. And the reason why I decided to use that type of isolation is that if you will take a precise look at the tooth number 21, you can see that tooth number 21 is a little bit wider than tooth number 11. So when you have slight difference between the width, or even with difference with the height of the teeth, and you cannot change sizes, you can play properly with vertical layering, with contouring, and then with finishing and polishing to make wider tooth slimmer, or slimmer tooth wider, because there are some optical illusions that we can use during our layering procedures and actually finishing and polishing that will help us to play with the highlights, giving the appearance what we actually want to achieve. If you want to learn more about that approach, I would like to invite you to our new online masterclass that is available on our webpage, online.belograd.com. You go there, and then you'll be able to see the topic, direct composite restorations. Here you may read program. The program will be very intensive. We will be doing silicone indexes, palatal enamel, dentin layers, mamelons, internal effects, tints, stains, playing with translucency, playing with the layering procedures. Then we will do proper finishing and polishing protocol, so you will be able to see everything by your own eyes during live demonstration process. Today I'm going to give you some clinical tips and tricks, definitely, but during online masterclass you will be able to see everything by yourself. This video is about benefits that you will have from our online workshop. Presence effect. This is a unique feature by Belograd Academy that literally moves you to our training center and you can stay close to speaker. This is like over-shoulder format. The training process is filmed through the video system from the microscope, and there are two more cameras broadcasting close-up and general view. This way, you can see everything in precise details. Efficiency. Do you agree, guys, that over-shoulder workshop with detailed video and explanation is way better than regular slides? The third benefit is convenience. So basically, you don't need to go anywhere, and you can study in comfort conditions, in your home, in your office, during running exercises, from your phone, from your computer, from your tablet, and you can do anything you want with the content. So join us as we shifted online education into the next level. So the next is, after that kind of tricks that we know, we can go for preparation for refining of the margins. And actually that is very important step, because if you will not treat enamel properly, peripheral enamel around your defect, you may get some optical differences between artificial part and your natural tooth part, like gray line, white line, or whatever. So one of the best way to treat enamel is to make it smooth with red stripe or yellow stripe burrs, diamond burrs. And also with this kind of shapes like rounded burrs or American football burr, you will be able to create chamfer or slight bevel that will be very useful for masking the transition between your restorative side and also the natural tooth structure side. Another thing is, after that I provided sandblasting, and you can see that there are some particles of some portions of composite that stayed. I observed and examined that portion of composite with a microscope, and I found that it was pretty nicely integrated, so I decided not to remove whole composite restoration. I removed the areas around dentin where was the caries, and then the rest I decided to keep. And after sandblasting, you'll be able to add your composite there, new composite, and to bond too. But what I'm trying to say now is that after sandblasting, or you may see that type of enamel here, that type of enamel, or it can be also visible not just after sandblasting, it can be also visible after preparation. So if you see the sharp angles, the rough surface, you have to be careful with, because when you will bond your composite or ceramic veneer or whatever, every single sharp internal angle creates a stress during polymerization process. So everything that is inside has to be very smooth and rounded. So one of the best options in such cases is to utilize disc or a rubber point just to smooth all enamel where you will add your composite. So now you can see it slightly rounded and more smoother, so we are happy not to have later on white lines between our restorations and teeth. After that we go for our bonding procedures. After that we started to cover dentin. In such a case we applied a very thin layer of flowable composite over the dentin. On the distal part of central incisors as well as lateral incisors we applied also dentin mass of composite. And I would like to highlight one very important point, the point that will help you to avoid gray optical transition between your restoration and tooth. So you have to apply a very thin portion of dentin over the beginning of chamfer. Okay, got it? So we have chamfer, which is here, or bevel. We have the bevel. This is our bevel all the way around. Okay, so when I will be using my dentin, I will have to apply dentin a little bit at the beginning of the bevel here, roughly. Okay, so that will help me to avoid so-called gray transition. But also what is important is to apply dentin in correct perspective from palatal to buccal side. So vertical component of dentin, or sagittal, let's say sagittal component of dentin, because if I will play, for example, this is palatal side, this is buccal side. If I will move my dentin up, I will end up with opaque restoration and nobody will be happy. If I will end up very low, my restoration will be gray because I'm using too much enamel in such a case. I think that you had experience with such bad outcomes when you have determined properly shade of your composite. For example, our tooth is A1 Vita shade and we decided to use also A1 dentin and A1 the tooth is A2 and we decided to use A2 composite, like A2 dentin and A2 enamel. Logical. But we placed too much dentin, for example, so restoration will be white or yellow. Or from other hand, if we will apply too much enamel, our restoration will turn to gray scale, to gray. It will be grayish. But we used enamel and dentin, the same shade as the tooth. So most important is not to define proper shade. The most important component is to determine the opacity type and to match opacity type of the tooth with our composite opacity. This is what we are going to discuss during this online masterclass that you can see, you can book and you can see on our webpage online.belograd.com. Here, direct anterior composite restorations step-by-step guide. There will be a pretty big blog about opacity, how to determine opacity, how to control clinically during layering procedures, our layers in order not to fail afterwards with opacity determination. Okay, now next is interproximal contact points. From my point of view, one of the best options to restore proximal areas is to utilize these sectional matrices that actually were designed for molar and premolar teeth, but we use them in vertical position with a wedge, 15 microns. We use them too, but not because we are going to restore two contacts at the same time. It's not a good idea to restore two contacts at the same time because you may end up with not tight interproximal contact. So now we are going to restore one and then we will be doing another one. And while we are restoring one interproximal contact, the matrix on adjacent tooth reserve space for proximal contact for that adjacent tooth. So that is the trick. And here you can see the way. So we have restored interproximal area on the tooth number 11 with enamel shade. Then we removed matrix from that tooth. We used another wedge, which is a little bit more tighter, to create tight interproximal contact. And now we are ready to restore another interproximal contact. So here is it. We end up with proximal contacts. But the thing is that there is a tip, by the way, and there is a slight of mistake that I got during this case. It's better if you have different width of teeth, like in this case, 11 was slimmer than 21. So it's better to restore first wider tooth and then the one that is slimmer in such a way that I showed you, because after the second tooth that you are restoring will be slightly wider afterwards. So that is the thing that we have to understand also. But you can play with layering, with the vertical layering on the tooth number 21. For example, if I will start doing more vertical components of my layering, and then I will go for finishing and polishing procedure properly, playing with highlights, I can optically make this tooth slimmer than it is. But for this one, for example, if I will go more towards that side with a highlight, we will end up with that tooth that will look like more wider than adjacent one. So this is the thing that you may know, and how to apply this during finishing and polishing procedure, and also during layering process when you will go with that sculpturing of enamel layers. Dentin, as I mentioned before, we apply dentin to the very beginning of the chamfer, then enamel, or before enamel, by the way, before placement of the final enamel layer, you can play with internal effects like using tints. You may use different tints to create some characterization, like here you can see chroma, ice, and azure. From my opinion, this is one of the best. These are one of the best tints in the market for composites. These tints are from Inspiro. This is the name of composite. Inspiro, created by my mentor Didier Dici. The perfect chromacity of the tints, the perfect opacity of the tints. They are highly flowable composites, by the way. And you know what is great? The ice is white tint, but it is milky white tint. It's not like an opaque white tint. The azure is blue tint, but it's not like a high chroma blue tint. It's like a little bluish to create nice bluish effect on the incisal edge. So if you want to play with that one, you feel yourself as an artist during making your direct restorations. You can use these tints and you'll be very pleased by the quality of the products. So if you decide to play with tints, you have to do this straight before applying the final layer of enamel. So you have dentin, then you do these stains or tints or colors, then you cover it with the enamel layer, and then you go for finishing and polishing procedures. This is straight after restoration and rubberdam removal. Here you can see before and after, and on that slide you will be able to see the texture, the relief, the structure from the lateral view. And you can see also the integration of composite restorations into the biological and optical environment of our patient's teeth. So that is the final slide for that restoration. And as I promised you at the very beginning, now I will give you an answer what happened with teeth of our patient before we actually started replacement of the new restoration. So again, this is initial. You can see the difference between enamel and artificial part, between enamel and her previous restorations. That step is visible, and we have to understand why it happened and how to avoid this in the future. So now the answer is it is abrasive. Abrasion. It is abrasion. She used, instead of toothpaste, normal toothpaste, she used a special old school tooth powder. Actually powder, really, the tooth powder, the old school thing that some dentists recommended her to use to avoid going to the cleaning, checkup and cleans after every half a year, because it cleans stain better than toothpaste. But you see that being abrasive, it removed layers of composite. So if we wouldn't get this into consideration, and we just imagine we just made the new restorations, and after half a year she will come back with the same in our case, because we have to ask what happened. You have to determine what happened, and to treat your patient, to teach your patient to avoid that things in order to get good long-lasting results in the future. So we were lucky to find out the reason. We explained her that toothpaste is better, and at the end of the day, once or 2 times a year, if she will see her dentist, will be good for normal dental hygiene, to repolishing of the restorations, and everything will be super fine. So that is the thing. Also, I would like to say that if you're interested more in composite restorations like posterior teeth, anterior teeth, composite veneers, copy-paste process, indirect composite restorations, tooth wear, and full mouth rehabilitation with composite restorations like a prosthetic protocols that can be transferred into conservative dentistry with a special guides using composite restorations, we have a very unique hands-on course that is called Big Composite Course and Rubberdam. You can find this one on our webpage, which is en.belograd.com. So here is Big Composite and Rubberdam course, and that is a unique course that I can say, because we teach all possible techniques of composite restorations, full mouth rehabs, transfer wax up into the patient mouth in predictable way, rubberdam isolation from A to Z. And this course is designed only for 7 people. Only 7 people, 2 days, maximum attention from my side to every single participant. And after that 2 days, you will be doing composite restorations with different approaches like a very pro. So, my friends, I was happy to present you that interesting clinical case. Hope you enjoyed it. Don't forget to sign up to our YouTube channel, to share this clinical case with your friends, and to put likes. And according to our tradition, I would like to say, may the dental force be with you. Thank you, and see you next time. Bye-bye.